You take off your shoes at the end of the day, pull off your socks, and there it is. Those deep red lines pressed into your skin. Your feet look puffy, feel tight, and when you press your finger into your ankle, the dent just stays there for a moment before slowly filling back in. That's not nothing. And if you've started to think of it as just part of getting older, I want you to stay with me for the next few minutes, because what I'm about to share may genuinely change how you feel in the morning. Before we go further, just a quick note. This video is for general health education only. If you have significant swelling, a heart condition, kidney disease, or any serious medical concern, please talk to your doctor before trying anything new. Now, let's talk about what's actually happening in your legs. Your heart pumps blood down to your feet with no trouble at all. Gravity helps, but getting that blood and the fluid surrounding your tissues back up toward your heart is a completely different challenge. Your veins rely on tiny one-way valves and on the squeezing action of your leg muscles to push fluid upward against gravity. When you're young and active, that system hums along quietly. You don't even notice it working. But as the years go on, those venous valves naturally become less efficient. The walls of the veins lose a bit of their elasticity. And if your heart is working a little harder than it used to, even without a formal diagnosis, its ability to pull fluid back from the extremities can slow down. The result? Gravity wins. Fluid pools. It settles into the lowest point it can reach, which is your ankles, your feet, sometimes your calves. By evening, those tissues are saturated. And here's what most people don't realize. Simply sitting in a recliner with your feet up helps some, but it often isn't enough. Elevation reduces the inflow of new fluid, but it doesn't actively drive the existing buildup back into circulation. The fluid is already there, stuck, waiting. That's the problem this routine solves. Imagine someone, maybe someone a lot like you, who's been dealing with this for years. Goes to bed with heavy, uncomfortable feet. Wakes up and they feel almost normal. Spends a few hours on their feet, and by afternoon, the swelling is creeping back. By dinner, it's noticeable. By bedtime, it's significant again. They've tried compression socks. They prop their feet up while watching television. It helps a little, but the cycle keeps repeating. What they were missing is what I'd call the mechanical part of the solution. Your calf muscles, when they contract and release, act as a secondary pump. Doctors sometimes call this the venous muscle pump, and it's genuinely powerful. When those muscles squeeze, they physically compress the veins running through them and push blood and lymphatic fluid upward. This is the same reason that even a short walk can temporarily reduce swelling. Movement is doing something that elevation alone cannot. It's actively propelling fluid back toward the heart. The ankle pump exercise takes that exact principle and puts it to work while you're lying completely flat in bed. Here's how it works. You lie on your back, legs straight, or with just a slight bend at the knee if that's more comfortable. No pillow under your feet. Flat is fine, though some people find that placing a rolled towel or a thin pillow under the calves, not the heels, gives them a gentle starting elevation that makes the exercise feel more effective. Now, slowly and deliberately, you flex your feet upward, pulling your toes toward your shins as far as comfortably possible. You'll feel the stretch through your calves and the front of your ankles. Hold that for just a second. Then, point your toes away from you, extending the foot downward. Hold again. That's one pump. What's happening during that motion is exactly what you want. Each time you flex upward, the calf muscle contracts and squeezes the veins. Each time you point downward, it releases. Done rhythmically, this creates a pumping action that pushes trapped fluid up through the venous and lymphatic channels, moving it away from your ankles and toward your core, where your kidneys can eventually filter and eliminate it. 30 seconds. That's roughly 20 to 25 slow, deliberate pumps. Done right before you sleep, this can make a meaningful difference in how your feet feel by morning. Now, I want to address something you might be thinking. If this is so simple, why hasn't anyone mentioned it before? The honest answer is that it has been mentioned. In physical therapy offices, in vascular rehabilitation programs, in post-surgical recovery protocols. Ankle pumps are a standard, evidence-supported movement used in medical settings to prevent dangerous blood clots in patients who've had surgery or who are on bed rest. They're used for exactly the same reason we're discussing them now. They work. The problem is that this kind of practical, low-tech information doesn't always make it from the clinic to the living room. It gets handed to patients on a sheet of paper after a procedure and then forgotten. Or it's recommended briefly during a doctor's visit and never explained in a way that made the connection clear. You may have been told to keep moving without anyone explaining why that specific movement matters for the specific problem you're experiencing. There's also a common mistake worth mentioning. A lot of people who deal with chronic lower leg swelling unconsciously start to rest more. The legs feel heavy and uncomfortable, so they sit still. They avoid walking. They stay off their feet. And in the short term, that feels like relief. But it quietly makes the problem worse. Less movement means less calf pump activity, which means less fluid clearance, which means more swelling the next day. It can become a slow, self-reinforcing cycle that's easy to miss because each individual day doesn't look that different from the last. That's not a failure on your part. It's just the body responding to discomfort in the way that seems logical. Understanding what's actually happening makes it easier to make a different choice. A few things that can strengthen the effect of this routine. If you drink a full glass of water before bed, assuming your doctor hasn't restricted your fluid intake, you give your kidneys the hydration they need to process and eliminate the fluid your body is now moving. Dehydration, counterintuitively, can actually encourage your body to retain water in the tissues. Staying well hydrated supports the whole cycle of clearance. Also, the timing matters. Doing the ankle pumps while lying flat, before you add a pillow under your head, before you shift into whatever position you sleep in, gives the fluid the best chance to begin moving while your body is in its most efficient drainage position. Flat means the heart and the lower legs are at the same level. There's no new gravitational pull working against you. Some people find that doing a second brief set when they first wake up in the morning, before standing, makes the transition to being upright feel noticeably easier. When you've been lying still for hours, some fluid can reaccumulate even overnight. A quick set of pumps before you stand can reduce that initial heaviness that some people feel when they first get up. Chronic lower leg swelling, when it goes unaddressed for long periods, can gradually stress the skin. The tissue stretches. The skin can become thin, fragile, and discolored, often taking on a reddish-brown tone from the pooled blood. In more serious cases, small breaks in the skin can develop into wounds that are very slow to heal because the circulation needed to repair them is compromised. This isn't meant to alarm you. It's meant to explain why something that looks like a cosmetic inconvenience deserves real, consistent attention. The good news is that the body responds. Circulation is not fixed. The venous system is responsive to consistent movement and habits. Many people who start doing this routinely report that within a week or two, the morning swelling is noticeably less. The sock lines are shallower. The feet feel lighter when they stand. These are real changes. Not dramatic, not instant, but meaningful. Pay attention to what your legs look like when you wake up. That's your baseline. If this routine is working, your morning feet should gradually start to look more like your feet used to look. If the swelling is not changing, or if it's getting worse, or if it's accompanied by shortness of breath, chest discomfort, or swelling that comes on suddenly and severely, that's your signal to call your doctor. Those patterns can point to something that needs medical evaluation. But for everyday fluid buildup, the kind that builds up slowly through the day, follows the pattern of gravity, and improves when you're lying down, this simple, gentle routine done consistently can offer real relief. 30 seconds. Flat on your back. Flex and point. Flex and point. Let your calves do the work they were designed to do. Your body already knows how to do this. You're just reminding it. If this was helpful to you, consider sharing it with someone you care about who might be dealing with the same thing. And if you'd like to see more videos like this, practical, clear, and built around what actually helps, subscribe so you don't miss what's coming next. I'd love to hear in the comments whether you've tried ankle pumps before or whether this is new information for you. Your experience might be exactly what someone else needs to read today.